So Kapalabhati is primarily a cleansing technique, cleansing pranayama we call it as. So this pranayama, it cleans. Especially that's what that shining. You can take any vessel and all. No, if you wash properly with the cleansing agent, now you can see the shining, right? Like that only. If you can practice is the cleansing agent, you can practice Kapalabhati. This is the vessel, it shines. That's what. Okay. So it cleansing, it what only the skull it's cleansing? No, it cleans the lungs, respiratory passages, then abdominal organs, the nerve channels, and even the mental toxins like negative and lethargy. The Kapalabhati cleans. Kapalbhati cleans these things and all. So it is not only from the brain, lungs will get the clarity, the pathway of the lungs we can clear, respiratory passage, so abdominal organs, nerve channels. So it is a powerful combination. This pranayama we are not calling as a pranayama, Kapalbhati pranayama. We call this as a Kapalbhati kriya. Pranayama means yesterday full 1 hour 15 minutes just you understood what is pranayama. That's a breathing, but it is a voluntary breathing. Voluntary breathing means we will take breath into our control by applying some tools. On the tool we are applying force, we will take the control. Breathing includes inhalation, exhalation. That is pranayama, right? Here why we are call it as a Kapalabhati Kriya means here active forceful exhalation is there. For the exhalation, we are applying force, but inhalation automatic. Inhalation passive. Automatically it happens. You need not put any effort or the force. So please remember this carefully, my dear students. In Kapalabhati, exhalation is active. Exhalation is voluntary. For the exhalation we are controlling, but inhalation is natural, effortless. We are not controlling, we are not applying any force. These two things you have to remember with the Kapalabhati, and also you have to remember it is a skull shining breathing. It more impact on the brain. Okay, so let us see the mechanism of this Kapalabhati. Let us understand scientifically, because if you wanted to understand any Vedas, any our scriptures, no, we have to, if you can go with the scientific perception, definitely you can understand uh, properly. Definitely, properly, we can understand without any negative impact, we can practice. So, during forceful exhalation, here the key point is while we are exhaling, it is effortful. We are putting our effort, we are applying some force, is it not? Here, the lower abdominal muscles contract sharply. Here, just please note down the point in your brain, not in your notebook. While you are exhaling, because let me talk about exhalation only, because we are applying, we are doing only exhalation in Kapalabhati. Inhalation, it happens. Let us not put our hand into that. Let us try to understand exhalation. So the lower abdominal muscles contract sharply. Okay, first one. Next, the abdominal moves inward toward the spinal cord. As I told you, where is the navel region is there? No, just back of that spinal cord, just behind of spinal cord is there. So we are that abdominal muscles moving inward towards the spine. Second one. Third one is the contraction pushes the diaphragm upward. That means when you are contracting inward, this diaphragm pushes upward. That means while you are doing Kapalabhati, your diaphragm, your chest region, it goes up. Your abdomen is an inward action. It will contract your abdominal region. So air is forcefully expelled through the nostril. Okay. First one is the lower abdominal muscles. We have to contract sharply. The abdomen moves inward to the spine. Next, third one is the contraction pushes the diaphragm upward. Pushes the diaphragm upward, air is forcefully expelled through the nostril. When the contraction is released, when the contraction is released, the abdomen relaxes, diaphragm moves downward. Naturally, air flows into lungs automatically without effort. This is natural things happen. When it happens, be careful, be carefully listen. When we abdominal muscle relaxes, that means first what we will do, sharp abdominal muscle contraction. I have told sharp. Here immediately we have to relax. That is the meaning here. Abdominal muscle sharply you are contracting, immediately relax. You relax abdominal muscles. Then when you relax the abdominal muscles, the diaphragm moves downward naturally. Diaphragm should be, it will be like this. It moves naturally downward. See here the space, you will get the space. Air flows into lungs automatically without effort. See now I am speaking. So that means I'm inhaling and then exhaling. Naturally it happens when you releases your abdominal muscles. This is very very important. Immediately you have to release and relax. You be relaxed, then automatically air will enter inside the lungs without any effort. There is no gap between exhalation and inhalation. There won't be any gap. You just exhale, immediately inhalation will happen. The speed is approximately the breath per second, one stroke. 1 second once. See, short. That means in 1 second, I will give the calculation and mathematics. In 1 second, one fourth of the second you have to contract, three-fourth you have to relax. One fourth you have to contract, three-fourth you have to relax the muscles. In that way you have to practice. That means 1 second once the strokes, it should be automatically it moves like this. Okay, see, you please observe my chest is coming up. Chest is coming up. The abdominal muscles, it contracts. YouTube, there is a clear, my full body, this thing is there. YouTube, my channel is there, Scientific Pranayama. You please subscribe there. There you will get all the video, some 3 minutes 2 minutes practicing video. Here you can observe, see on my face there is no efforts and all, only abdominal muscle sharply just I will contract and I will relax and then wait. When I relax, my chest will come up, diaphragm will go down, air will fill, immediately air forcefully it coming out. This is Kapalabhati. Very simple. If you can understand the scientific points, it's very, very simple. Kapalabhati practicing, but you have to be aware of mathematics and then science. Here, let us see scientific explanation how you can understand how that means this pranayama Kapalabhati works on principle of impulsive in physics. Impulsive law of physics. Impulsive means sudden. Sudden energy here it will be we are generating sudden energy. So this is impulsive law is that equation is impulsive means sudden energy. Sudden energy when it comes, that intensity of the energy depends upon the force and then time. Short time, how much force you are applying, so much intensively you will get the energy. So energy is equal to how much energy, if you wanted to measure, means that energy is equal to force you are applying in short period. How short, in which short period you are applying how much force, that depends upon the energy production. This is impulsive physics. When force is applied in a short duration, pressure increases rapidly. So, you can, yeah, yeah, just you see the scorpion bite, snake bite. So scorpion, no, just sudden it is. Even snake also sudden compared to other animals and all. That sudden, that impulsive sudden action of that snake or scorpion, you can see how much venom it releases. That depends. Okay, that is, that's why the pressure increases rapidly. You just see, if you just hit like this, no, you just see how much the pain it will be. Otherwise, if hit like this, that's sudden, if it hit like this, no, so you can see the pain. In that way you can understand this impulsive energy. The pressure increases rapidly within short period. If you hit somewhere, here vibration are transmitted to nearby organs. Here, as I told you, during the pranayama, after what you are, what kind of energy you are producing, generating, means vibrative energy. Vibration is complete energy according to quantum physics. So that vibration, where in the navel region, that's in the abdomen region, you are generating by impulsive force, you are applying that abundance energy, it will be, you are generating that, it immediately transmitted to nearby organs. It immediately transmitted to nearby organ. That means abdominal organs it impacts. And then spinal cord, back of that abdomen, spine is there, so immediately it impacts on the spinal cord. What happens, spinal cord, the energy, just it flows and distributed into the full whole body, and then it just transmitted to the head region. That's how skull shine breathing is happen. So Kapalabhati is a force applied at a navel region, created pressure and then vibration there. These vibration stimulates abdominal organs, that means liver, pancreas, kidney, intestines, spinal nerves. These are all spinal nerves. We call it as a peripheral nerve. That side nerves. The spinal cord is center. For the spinal cord, many nerves. It's running left and right, all body. That is called peripheral nerves. Spinal nerves. It connects. So this stimulation improve our blood circulation, metabolic activity, cellular rejuvenation. These things will happen by transmitting this vibrative energy throughout our body. That's why Kapalabhati is highly energizing, highly energizing. So this is how to practice. Once again, just I will tell you the methodology. Sit in a comfortable posture. Comfort, especially back, since it is impact on your spinal cord. Your back should be straight. I'm not telling spine, your back should be straight. So that for the alignment of neck and then head should be there, with the low back erect. Okay, keep shoulders relaxed. Close your eyes gently. Focus only on lower abdomen. While you are practicing, your focus should be on lower abdomen, nowhere else. So now you contract your lower abdomen sharply, and then expel air forcefully through the nostril. It happens. Pranayama, it is an experience. If you can practice like that, you can experience. As soon as you contract, immediately the air will split out from through the nostrils. Immediately after that, no, immediately we have to relax the abdomen region. Then only inhalation will happen. Okay, the air will be filled in the lung, the gas exchange will happen. That means from the lung alveoli to the blood, gas exchange, oxygen will enter inside our blood. Otherwise, if you are not relaxing your muscles, if you are keeping like this only, means hypoxia. That means oxygen scarcity will happen in your body. That is called hypoxia. Don't give chance for this. That's why Kapalabhati and all, afterwards, if practicing during the Kapalabhati or after practicing the Kapalabhati, if you feel, if you can feel that you are tired, means somewhere you are just creating a vacuum, you're holding too much. Okay, immediately you have to release and then wait up to 1 second. Okay, 1 second one. How you can count 1 second? Nowadays in the app is there in the mobile. Otherwise, the wall clock tick, 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 each tick, one stroke, quick burst. Kapalabhati, each 1 second once, quick burst should happen. Let inhalation happen naturally. Allow them inhalation to happen naturally. If you are taking inhalation forcefully, exhaling forcefully means that's not Kapalabhati. That will become Pranayama. Kapalabhati is a Kriya. Pranayama Kriya it is. Inhalation should happen naturally. So repeat this rhythmically. Begin with 60 strokes, 1 minute continuously. Beginners know the first time who are doing some 30 to 40, 50, 60 strokes, try to do it 1 second. You just 1 second, 60 strokes. You just to do it 60 second. And then afterwards, if you want to take rest, just inhale, exhale, then you continue. Repeat for 2 to 3, 4, 5 rounds. If you can, you continue up to till 10 minutes or 15 minutes. That is the maximum limit you can practice. So here I would like to give important. Here, the gradually you have to increase this Kapalabhati, starting first time. If you can sit, no, madam told no, I can practice 15 minutes, 10 minutes continuously. Don't strain your abdomen. Don't strain. Okay. So, starting 1 second, 1 minute you do it. Take rest, one or two, three, breathing, then continue. Like that, if you can continue, how much you continue? Okay, like that, no, you can complete at least minimum 5 minutes. So 10 minutes if you can finish, it is very good. 15 minutes you can do it means beautiful. Okay, you can complete that. Here, important instructions I would like to give, my dear students. Practice on an empty stomach is compulsory. Here, one question they are asked. Usually, I have repeated all these things. They keep on asking the question. Empty stomachs means food after minimum 4 to 5 hours. You have to practice solid food. If you are taken any liquid food, solid food, maybe a sattvic, maybe spicy, whatever you will eat, no, you need 4 to 5, because in the stomach, according to the science, the 3 to 4 hours food will be there, churning is taking place. It has to go down to the intestine, then you can practice. So 4 to 5 hours empty stomach with solid thing, whatever the food is, then liquid food, any liquid food, coffee, tea, milk, juice, anything, no, after 2 hours you can practice. Okay, water, if you drink water means 45 minutes to 1 hour. You have to give the gap and then you can practice. This is the meaning of empty stomach. Keep full awareness on exhalation only. Don't think about inhalation. Ma'am, I'm keep on doing exhalation means when we are going to take inhale, don't worry. Naturally it happens. You release the abdomen. That's all. You have to release the abdomen. Keep full awareness on the exhalation. Do not strain the face, eyes, shoulder. No. Okay, you should not strain the face, eyes, and shoulders. Breathing should be rhythmic. Like that, rhythmically you have to do, not violently. Okay, violently should not. Please don't do that. Okay, don't practice that. Stop immediately if you feel dizziness, any dizziness and all, no, you please stop the practice. So I will just tell you who can practice, who should not practice this Kapalabhati. Let me tell you benefit of it, then afterwards I will explain that. Regular and methodically, if you can practice Kapalabhati, detoxification, 80% of toxins will leave through exhalation. You can just omit, or you can just emit the 80% of toxin in your body. Purification of the blood, weight management, any fat, due to the fat your body mass, your body weight is more, means definitely the weight loss will be there. Improve metabolism, daily activities, it will be improve the digestion. You can see after practicing pranayama 2 to 3 days beautifully, if you are not feeling hungry and all, you started feeling hungry. If you are feeling more hungry and all, it reduces. Okay. Activation of pancreas, because that is the nearest organ which is present in the abdomen while we are giving the force. That means it's supportive to the diabetic. Kapalabhati is supportive to the diabetic. But here, the diabetic BP are twins, brother and sisters, are cousins, always together. If one comes, no, again next. Usually that comes. So who are having BP? It is only good for the diabetic, not for the BP. If you're having BP and diabetic, means no, it is not. Kapalabhati is not good for you. Only if you are diabetic, if there is no hypertension, Kapalabhati is too good. Definitely, you can what you can decrease your medication. Okay, so due to practicing Kapalabhati, it strengthens your lungs, improve oxygen supply to brain, increase concentration because it impacts on your brain. No, it improve concentration, memory, focusing, and relief from the sinus problem. Any sinus means the gaps. Usually, everywhere the gap will be there. It will be filled with some stale hair or phlegm or something. These sinus, due to that, if sinus problem is there, no, you can reduce from this. It will give the relief. Reduction of lethargy. If you are lethargic, everything, morning you wanted to sleep, then morning you will get up lately, afternoon you want to sleep. Those things are all lethargic characteristics. So you can reduce it. Definitely you can see after 1 week of practicing pranayama. So increase facial glow. You can see your face, your friends, your relatives says, hey, what Devaki, you are not like that. Like your face is somewhat changed. Are you coming from what? Spa, not spa. The way have you done any facial like that? They will ask. Okay, in that way your face started glowing. Okay, balancing emotional state. You can very well balance emotion states. No, that anger and all. You can see you will get the calmness. So reducing depressive tendencies. Whatever somebody says, something is happened, no, immediately we will go to the depressive state. So those kind of depressive state and all, no, definitely it will be reduced by practicing Kapalbhati Kriya. It whole entire system, entire body will be energizes. So keeps the body warm, active, the nerve channels, especially nerves, nadis. There is a different kind of nadis are there. The nerve nadis, no, it detoxify, it cleans. So who should not do this? Here is the point. Who has to avoid? What kind of person has to avoid this? So pacemaker or stent patients, please don't practice Kapalabhati. Many students, their man, since so many years I am having a pacemaker stent and all, no, but I am practicing Kapalbhati. I did not get any kind of this thing and all. Am I continue? I will say no, because your pacemaker or stent, the what the life, no, it will extend if you are not practice. If you practice Kapalabhati, it reduces the life of pace and then stent. Okay, that hernia patients, they should not practice. Slip disc, if it is there, they should not practice. Epilepsy patients, first of all, epilepsy patient, when epilepsy comes, no, they cannot control their body. With that, if you practice Kapalabhati, it is not good. Those kind of person, they should not practice. Abdominal surgery, especially abdominal surgery with 1 year, they should not practice, because Kapalabhati Kriya we are applying to the abdomen only. Okay, pregnant women, They didn't even dream this Kapalabhati during menstrual cycle. Yes, I have read many books. They have mentioned that they should not practice. But my experience says if you are comfortable with bleeding and all, then you are comfortable. No cramps, no stomach pain and all. You can practice. It cleans that also. But if you are having any symptoms like that, no, that cramps, stomach pain, heavy bleeding, they should not practice this. See, if you are having a severe back pain, no, those also. So these kind of, if it is any health issues are there, no, you please contact specialist, scientific pranayama specialization who has done, and then doctors also. You please consult. Then afterwards you can go through that. High BP, without any, even with the tablets and all, you cannot control high BP. Cardiac patient must practice only under, they also should not practice. But sometimes I told, BP and diabetic, even cardiac problem is there, even they also having diabetic, means because this pranayama is good for diabetic. So you please consult, take the therapy with the scientific pranayama specialist. Okay, they will see, they will counsel, they will they will check your background reports and all. No, they will guide you properly. So if you practice this Kapalabhati for 10 to 15 minutes, if you are not done incorrect, if you are not done correctly, if your practice is incorrect, means what are all side effects? I wanted to explain this, I wanted to tell you this. One is dizziness. Definitely when it dizziness comes, you stop it. Headache comes, means yes, definitely you are doing somewhere wrong. Vomit sensation, definitely you are doing something wrong. Dryness in your mouth, something you are doing incorrect. Sweating, you are doing incorrect. Rise in blood pressure, you are doing incorrect. Hernia risk, if hernia there, no, hernia people, they will be knowing, they can see something, some sensation is there. Okay, these things and all, if you it happens. Sweating means sometimes starting, no, it sweats, afterwards it should stop. Okay. So these kind of these are all anything, if you are face this problem, no, immediately you stop and then consult me. Okay, therefore technique plus awareness plus moderation is equal to safety. In Kapalabhati, we have to follow proper technique. We have to aware of all the yama niyama which is governed by Kapalabhati. Then only the safety. The Kapalabhati is safe for you. Okay, so according to me, my final message in Kapalabhati, because why the people are living the pranayama means this is the, they will start doing Kapalabhati. If something headache, dizziness means it's something, it's scary, right? They will stop pranayama. Definitely, if you can practice properly, you need not stop this. So this is the Kapalabhati is not just breathing, my dear. It is not just breathing. It is a cleansing science. It is a metabolic activates. It's a mental purifier. This Kapalabhati, we can say it's a cleansing science. It's a metabolic active. If you private your metabolic activate, know how much it. So we can say it is a metabolic activer. It's a mental purifier. All negatives will go off. Then energy generator. I can say this Kapalabhati. So I would like to give a name for this. Kapalabhati is a Maharaja, king of all pranayamas. So the king, how he is favor for us, like that only. If you get the angry, if you are not followed his rules and regulation, definitely he will get the angry. When king gets angry, our life is miserable. But when king is happy with our karmas, with our work, we are the blessed one. So Kapalabhati, I'll compare to the king. Okay. So you can understand better. So when practice this Kapalabhati scientifically what I have explained now, it rejuvenates the body, sharpens the mind. But remember, powerful techniques demand responsibilities. When you touch the power, when you touch the energy, okay, when you touch the king, it demands response. You had to say, take some responsibility, right? One is practice with disciplines, practice with yama niyama, practice with awareness. So in the what are all awareness you have to take while you are practicing? Your awareness, your focus only on abdomen region, right? Practice under guidance, proper guidance, proper pranayama teacher, those who are practitioner. At least Kapalabhati, if they wanted to teach you, means daily minimum 20 to 30 minutes they have to practice. Then only they can experience, they will be knowing what is happening in their body, so they can teach properly. So Kapalabhati become a transformative tool. Definitely it is a transformative tool for health and vitality. Health and vitality. This is of Kapalabhati regarding. I hope you can understand. Okay, if you wanted to understand more, deeper means monthly session we are conducting every 1 month, daily 1 hour, 15 minutes to teach and then make you practice and then correct. That's a monthly. The next week it's going to start from, we are starting from our trust. My senior and then research scholars, they are taking, they are handing the classes. They are having minimum 5 years of pranayama experience. So you can join. I will send all details in the group. Next, the pranayam, Sheetali pranayam. I will call this as a upa pranayama, right? Some subdivision like that. So, this is, we call it as a cooling breath. Sheetali means if you practice this pranayama, during the practice of this pranayama, you can feel something cold air you are just inhaling. So, dear students, now let us understand very beautiful and balanced pranayama, Sheetali pranayama, because in Ayurveda they are giving more preference for this. The word Sheetali, again, the scientific methodology comes from Sanskrit. Sheetala means cool. Sheetala, cool, calm, soothing, right? It represents a pleasant inner cooling sensation. So it is a supportive pranayama for especially Kapalabhati. So in Gulbarga, some heat places and all, no, when the temperature is more than 40, 45, if you practice Kapalabhati, some 3 times Sheetali, if you practice, that's enough. That's what my guidance, my advice. But in this weather, cold weather, or if you are a asthmatic, otherwise near windows, doors, should not practice Sheetali. Immediately it impacts on your lungs. Okay, why the Sheetali name? It's so in daily our life we experience excess of heat, then anger, stress, so hyper acidity, okay, irritability. So we'll go in the sun and all, no sunlight exposure, sunlight, physical exhaustion. When these condition, in such condition, Sheetali acts like a natural air conditioner. Only what above I have mentioned, in that situation, the Sheetali act like a natural air condition for our body. It activates a natural evaporative cooling mechanism. If you practice in those situations, no, this is a natural evaporation cooling mechanism, like in our body. It works when cool air passes over the moist tongue. This is a, we have to collect the saliva on the tongue and then we have to inhale through only this supportive pranayama. We are inhaling through the mouth. Okay, we have to open, we have through on the tongue, no, the air will flow inside. Okay, so it's creating a cooling effect. That is the gradual influences deeper tissues. When it goes like that, that evaporation, that water, that coolness, no, gradually it influences deep tissues. So interestingly here, while it cools excess heat, it also gently stimulates digestive fire. Our digestive, when it's started cooling our body, It motivates our digestive fire, just like hidden coal glowing under cool ash. Okay, when air passes, no hidden that coal, no on that ash will be there. If air passes, how you can see the heat, how you can see the fire. In that way, it happens. Here, the practice is it's important and interesting also. So it's especially this Sheetali practice beneficial during hot climate. Okay, hot climate. Without hot climate, don't practice this pranayama, please. After intensive physical work, like a sport person, no, even physical work, who will do after that? No, see, we will say, like that we will take naturally, right? Naturally, sometimes we will practice Sheetali pranayama after sun exposure. If you are suppose you are forced to walk in the sun, you are exposed to the sun, means then also this pranayama is good. During emotional agitation, angry, if you get angry, sometimes you might observe like that we will do it, right? See that those are all natural Sheetali, it inbuilt attitudes. We will just to do it that after Bastrika or Kapalabhati, if excess heat is felt, underline this, after prana practicing Bastrika and Kapalabhati, if you feel, okay, excess heat, then you have to practice this 3 times. That is enough. Ayurvedic perspective, Sheetali balances pitta. Okay, natural excess vata, and then pitta. That is of an Ayurveda condition. However, it should not be over practice in cold season. But my advice is, in cold season, don't practice this pranayama. Avoid this excessive internal cold. Okay, practice cautiously in low BP cases. If you are having a low BP, this is not at all good. The method of practice is: sit comfortably, stretch your tongue, collect the saliva and the tongue. If you can roll the tongue, you roll it. Otherwise, no worry. You just started inhaling slowly with closed eyes. Stretch your tongue, collect the saliva, and started inhaling. So after inhale, you just deep normal breath there. So if you can roll the sides up upward like a tubular way, your tongue, you can do it. Otherwise, if the tongue cannot roll, perfectly fine, no problem. Slowly, you have to inhale slowly through the curtailed tongue, your extended tongue. No, feel the cool air passing inside. Observe the cooling sensation in the tongue. Okay, then after inhaling, no, withdraw your tongue inside, close your mouth, swallow the collected saliva, hold for few seconds, some 2 to 3 seconds. If you are in your comfortable, exhale slowly through the nostril. This completes one round. Practice it for 2 to 3 rounds generally, but in cold season, don't practice. In heat, in the summer, more than 40-45 minutes, you can go up to 5 rounds. Let me demonstrate once. This is Sheetali practice. Important instructions is empty stomach is necessary for all the pranayamas. Practice in a clean, non polluted environment because you are inhaling through your mouth. This is the only pranayama inhaled through the mouth. Observe internal cooling sensation. Do not overdo in cold weather. Don't do only. Okay. Benefit is reduces excess body heat, balances pitta, reduces hyperacidity, improve digestion. If a high BP is there, this pranayama is good. It just lowers the blood pressure, calms the anger, emotional heat, reduces inflammation. You might have seen any burning and all, now will say like that, because see, those are all natural things we are doing daily, right? So it reduces inflammation, soothes abdominal pain, reduces excess hunger and thirst. When you are hunger and thirst, if you won't get food or water and all, no, in that time you can practice this Sheetali some 2 to 3 times. Enhances immunity, create deep mental peace. It is excellent for people with highly fiery temperament people. Really, I recommend this. But who should not do it, who should avoid means low blood pressure persons, asthma, bronchitis, excess mucus if it is present, chronic constipation, severe respiratory disorders, cardiac patient. So they should not practice this pranayama. This is Sheetali Upapranayama. Let us come to the next pranayama, Bahya Kumbhaka. Bahya Kumbhaka. Again, let us apply scientific methodology. Bahya means external. Kumbhaka means retention of the breath, holding the breath. Let us understand a very powerful internal practice this is. If you can practice this Bahya Kumbhaka 10 times, you can experience all your organs movement inside. Okay. So this is external retention. Here retention means holding the breath after completely exhaling. After you empty your lungs, you are not allowing air to come inside in your body. In such a way, you are holding outside. This is called Bahya Kumbhaka. So, what is special in this Bahya Kumbhaka? See, Bahya Kumbhaka, what is special? So here the breath, the speciality is we are not at all allowing air. The breath is retained outside. We are holding outside. That means forcefully we are holding. That means we are not allowing natural things to do, right? Then tribandhas are applied just to hold the breath outside, air outside, just holding the outside means we have to apply 3 locks. 3 doors are there, important main doors: front door, back door, side doors. 3 doors you have to lock and go. Otherwise, from the outside, air will enter. It happens for me. If I wanted to go, I mean, while I'm just in the office and all, no, with my children and all, I have to lock 3 doors. So after exhalation completely, we are retaining the air outside. Three bandhas are applied, 3 locks we are applying. Internal organs are deeply we are doing exercise because we are strain we are just we are little bit strain our internal organs because like a lungs we are not allowing respiratory system to work. When respiratory system is not allowed, that oxygen and carbon gas exchange doesn't happen. When gas exchange doesn't happen properly, the supply of the oxygen to each and every cell will be curtailed. It reduces. That means tissues, organs, and systems, it's not working properly. That means internal organs or systems are exercised deeply. Okay. It's like an internal massage for abdominal organs. All organs, which it's an internal massage because we are applying like that. It will give the massage for our internal organ. The human body consists of 37 trillion cells, right? Yesterday I told you every cell needs expansion and contraction because every cell is in elasticity in nature. Every cell we can apply, we can correlate Hooke's law of elasticity. Hooke's law of elasticity, it says it is the characteristic expansion and then contraction, naturally it happens. So each and every cells are like that. That means all the cells are elasticity in nature, means our tissues are elasticity in nature, organs are elasticity in nature, systems are elasticity in nature. So that contraction, it needs exercise. So physical exercise, just to otherwise no brittle, light, the movement is not proper in our body and all, we will get the pain, cramps and all. For that we are doing physical exercise, at least simple walking we are doing, right? But please think about your internal organs. Those internal organs also needs exercise. Only pranayama can provide exercise. Pranayama, in the pranayama practice only you can give the exercise for your internal organs. Okay, especially Bahya Kumbhaka, it does that. So Bahya Kumbhaka provides internal exercise for digestive system, endocrine systems, and reproductive organs, nervous system. These systems and organs will get the exercise. Here, method. I told you three locks, right? Three in a three region, three way of locks are there. One is in the throat region. Throat region we are locking so that air cannot enter it naturally. If enters through the nostril also, just here we will put the lock. For this lock we can call it as a Jalandhara Bandha. You can call it as a throat lock also. If you cannot remember that Jalandhar Bandha, you can call it as a throat lock. Another one is navel lock in the navel region, abdominal region. Uddiyana Bandha, we call it as in the abdominal lock. Third one is anal lock, Moola Bandha in the moola, in the end of our body. Okay, the body systems, the excretory system, pelvic region we will apply. Because here the air entry, if we can stop, air cannot enter inside the lungs. But from the even in the navel region, it can enter. It can enter because mother and then child connection was there. So umbilicus. So there also we have to put the pelvic region. You know, anus. Okay, vulva, our genital opens are there. That through that also air can enter. So we, if we wanted to lock these three region, then only air can, we can hold the air outside. Okay, so Jalandhar, how we can lock this means here there is a channel is there, a breathing channel. You just bring this chin to this. Here two bones are there. In between this bone, no, you try to touch this chin. That's all. This is Jalandhar Bandha. After applying that, no, you just contract this neck muscles. You just hold, contract this neck muscles. That will. This is a Jalandhara Bandha and a Uddiyana Bandha. In the navel, Kapalabhati, you are already done. You learn it. In this, you just think this is the navel region. These are all the abdominal muscles. You just contract the abdominal muscle inward. See, here navel point is there. If you can control, if you can contract these muscles, no, the navel, you can close the navel region. Okay, this is called Uddiyana Bandha. In pelvic region, pelvic floor. This is the pelvic floor. In here, the anal, one is urinary tract is there, one is our childbirth tract is there, another one is anus is there. These are all three locks. So here for the male and female, it is little bit tricky. For the male, only two openings. For the female, three openings. One is our birth. This thing. So here we have to contract pelvic muscles and uplift. Contract the pelvic muscles and then uplift. This is Uddiyana, Moola Bandha or anal lock. If you cannot understand, you can say anal lock. These three locks we have to apply comfortably. Comfortably, you have to apply. Then, first, you have to empty your lungs, exhale completely, then apply the chin lock, navel lock, and then anal lock. Jalandhara Bandha, Uddiyana Bandha, and then Moola Bandha. These three locks you apply. Comfortably, you hold the breath outside only 3, 4, 5 seconds. So, with on your comfort only, you have to do this pranayama. Then afterwards, no, you just chin up, release the abdominal muscles and pelvic muscles, inhale comfortably beyond your capacity. If you can hold the breath while you are inhaling, no, the inhalation will happen suddenly. It should not happen. Slowly, gradually, you have to inhale and then exhale. Here the inhale and then exhale ratio is 1 is to 2. Minimum 1 is to 2. Now, how much inhale for the inhaling you are taking the time? Maybe 4 seconds. While you are exhaling, it should be 6 seconds. Exhalation should be more. The retention of the breath, the holding the breath, it just is starting from 3 to 4 seconds. You just take that. That is enough. Release. Like this, no, some 5 to 10 rounds you have to practice. Okay. Let me show you. For this, no, you can take like this. First, only you can just the shoulders, no, up like this. Like this, some 10 rounds. 10 rounds you complete. If you are having a back, I mean neck pain, so don't they you should not forward bend. Instead of that, no, you just take like this. Chin is there, no, just back. That's it. Instead of doing like this, any spondylitis or neck pain is there, though they should not bend their neck. So benefits of Bahya Kumbhaka, it strengthens digestive system. If it is any constipation, acidity, no, Bahya Kumbhaka is good. Prostate, reproductive health, it addresses. Improve your cognitive reactions like concentration, focus, memory power. It enhances mental health. You will get the clarity. So emotional stability, you can manage your emotions. So builds internal discipline. I told you, this is a internal exercise, internal discipline. That means the coordination with the organs, systems, and then tissues. It will be disciplined manner they started acting. It trains the mind. It trains the mind to remain steady under any kind of pressure. Any kind of pressure, if you are in your life, no, if you can practice this daily 10 rounds under any pressure, you will be steady. So, don'ts. Who should avoid this? Pregnant women during menstrual, cardiac problem, severe hypertension, any BP medication for the hypertension, they should not, they can practice, but holding should not be there. Hypertension people, they can practice, but they should not hold the breath. Apply the bandhas and release the bandha. Never strain beyond your capacity, because this pranayama works on Hooke's law of elasticity. Wear and tear will happen. Pranayama is not just breathing. It's not just breathing, please. It is an internal science. Organ, it gives the exercise for the organ. Nervous system, it regulates the nervous system. Emotional purification. Energy, your energy, you can masters in your energy. That Kumbhaka Rishi Munis know, they will practice in such a way. Remember, powerful techniques require, again, once again, I would like to explain this. Always, any power, any energy, any benefit, it requires discipline, awareness. What you are doing, you should be aware of it. Gradual progress, starting itself 10 times, 20 times, otherwise holding is 10 seconds, 20 seconds, don't do it. Gradual progress, proper guidance, you have to learn this with proper guidance. That's what I, even in last previous class also I told you, though you are attending online, please try to attend offline classes. Choosing this online session, please try to understand this pranayama, what is this pranayama, and all try to implement on your life to maintain your physical mental health, especially upliftment of mental health. Thank you very much.